Hi, my name is Grant Cullen and I'm a student of physical therapy. How are you today?
Good.
Good. So I was reading over your chart. Looks like you had a concussion. Potentially you hit your right side and you're kind of having issues turning towards your right. Does that sound correct?
Yes.
Yeah? Okay. So what we're going to do today is we're going to do some tests. We're going to do some stuff with your eyes, your head. I'm going to kind of make sure everything's okay. Make sure there's no nothing going on there. And kind of also check your neck. Is everything going to be okay with you? I'm going to have my hands on you. Is that going to be all right?
Yeah, that's
Sounds good? Okie doke. So first thing we're gonna do, I'm gonna have you scoot over here. Normally I'd be on a table, but for the sake of the video, we'll use this couch. So first things first, I'm gonna screen your neck. So go ahead and just look over to your shoulders as far as you can. Both directions, just nice and slow. I wanna see how far you can go and look up towards me. Good. These findings are normal. I'm then gonna have you tilt your head slightly to the right. I'm gonna compress. How does this make you feel?
Fine.
Fine. What if I come here? Anything?
Fine.
Is this reproducing any symptoms?
No.
No? Okay. You can go ahead and come back to the middle here. Since you had a concussion, do you have any sensitivity to light or to sound?
No.
What about any history of fainting, difficulty speaking, difficulty swallowing, anything like that?
No.
No. Obviously, I know you're coming in for dizziness, any nausea with that?
No.
No. Okay, perfect. So let's go ahead and begin the exam. So first, scoot this a little bit closer. So I'm gonna have you keep your eyes on my nose, and then I'm gonna have you keep both eyes open. I'm gonna cover one eye at a time. I'm just gonna watch what your eyes do, okay?
Okay.
Let's go and keep watching here. Here. One more time. Good. This seems normal. Then I'm going to be watching during the exam for any spontaneous nystagmus. I find it negative. Next, I'm going to grab my pen. So you go ahead and just watch the end of my pen here. It's nice and red, so it's easy to follow. And you're just going to keep your eyes on it and see how far we can go here. Come all the way up. This seems normal. Come to the other side. Good. This seems normal. Keep watching my pen. I notice slight saccadic movement in his eyes. I'm gonna have your nose pointed at my nose, but I'll have you look with your eyes and gaze over my shoulder. Good. Now try the other side. Good. I notice a little bit of nystagmus, so I'll have you look here at my my pen here. Good. I notice less nystagmus. Same thing on this side. Good. Same thing, less nystagmus. Go and watch my pen one more time. Tell me when you start to see double.
Right there.
Good. It's about 8 inches, which would indicate a positive for the convergence test. I'm gonna have you look over at the pen and then now look at my nose. Pen, nose, pen, nose. Here. Pen, nose, pen, nose. Up top, pen, nose, down below. Pen, nose, pen, nose. They seem normal. So we're gonna I'll have you sit forward a little bit. This couch is a little deep. And sit nice and tall for me. What you're gonna do is I'm gonna move your head a little bit. You're gonna keep your eyes on my nose. I'm just gonna kind of move you slightly down, move you nice and slow. I notice a little bit of saccadic movement when moving towards his right side. Now I'm gonna take your head, I'm gonna do a little bit of a head thrust test. Just wanna give you a heads up so you're prepared for it. Just go ahead and relax, let me move your head. Keep your eyes on my nose. I notice slight corrective eye movements when going towards the right. Next, I'm gonna have you arms forward. You're gonna look at just one thumb. I don't like the double. So then you're gonna rotate your body just side to side, keeping your eyes on your thumb, and I'm gonna watch your eyes. Try and go a little bit quicker. Try and match my tempo. 1, 2, 1, 2, 1, 2, 1, 2. Good, we can be done here. Was this eliciting any symptoms?
No.
No, okay, perfect. Next, we're gonna be doing a head shake test. For the sake of the exam, we do not have the equipment necessary, but I would put goggles over your eyes, and then I would have you close your eyes and then shake your head 20 times, and then watch for his eyes over his right, middle, and to the left. And then I find that that is normal. So that is the end of all of these tests. Double check that I have everything done. Yes, that's gonna be everything. So now we're gonna go ahead and do some positional testing. So have you sit all the way to the edge of this table here. So this is called the Dix Hall pipe test. What this is gonna do is it's gonna cause some positional changes within your ears, and if that's what is causing your symptoms, you're gonna feel really dizzy. It's gonna reproduce those symptoms that you're coming in for. So what I'm gonna have you do is you're gonna keep your eyes open the entire time and turn your head slightly to the right. And then when you're ready, you're gonna drop down and your head is actually gonna be hanging off the edge of the couch, and I'm gonna be holding you the whole time. That makes sense?
Mm-hmm.
Okay, so turn to the right, and then ready, 3, 2, 1, drop. Keep your eyes open for me. I don't notice anything. How do you feel?
Fine.
Feels fine? Okay. Hold you for a few more seconds. Good. You can sit back up. Normally I would repeat this towards the left. However, because of limited space, I'm unable to. Both sides are negative. I'll now perform the roll test. So I'll have you lay back down on the couch all the way this time. Get you as comfortable as we can get. Normally I would adjust the table here, but for the sake of the exam, I'll just pretend, get a little bit of a squat. Head flexed at about 30 degrees. What I'm gonna do is I'm going to rapidly roll your head to one direction. You're gonna keep your eyes open, and you tell me if you feel any of that same dizziness, and I'm gonna watch your eyes. Okay, ready? 3, 2, 1, go. How do you feel?
Fine.
Feels fine? I noticed nothing. I'll repeat again on the left side. 1, 2, 3. I noticed nothing with the eyes. How do you feel?
Fine.
Feels fine? Perfect. You can go ahead and sit up. So what I believe is happening is after the concussion, you have what's called a unilateral vestibular hypofunction. Basically, in simple terms, what that means is there's a nerve inside your ear that kind of helps coordinate your balance and it's communicating to your brain. After the concussion, that nerve got a little bit damaged, and so it's a little bit more affected on your right side. So that's why turning to your right, you tend to notice a little bit more changes. When we were doing some of those eye movements, I noticed you're having a little bit of that nystagmus, or the eye beating towards your left. All this is normal, and all this is very treatable. It's just gonna take time, it's gonna take a lot of repetitions. So what we're gonna do in therapy is we're gonna do a motion called saccades. So what I'll have you do is I'll have you stick both thumbs out. Go ahead and follow with me. Yeah, right about there is good. And then you're just gonna keep your nose pointed forward and look with just your eyes in between your thumbs. Go at your own comfortable pace, and I want your thumb to be in focus each time. And then as you get more comfortable, you're gonna increase the speed. We're gonna do this for about 30 seconds. For the sake of the exam, we won't go through the full thing. You can also go up and down. Good. I'll have you range a little bit lower. Good. And just bouncing between up and down, up and down. These are also good things you can do for the home exercise program. I'll provide a handout for you so you can follow along. You can go ahead and put your arms down. Basically what I want to treat is focusing on that gaze stability, because you're having some of that nystagmus with some of the eye tracking motions and some of the head turn things that we were observing. And so what I want to do is I want to strengthen that system, and I want to challenge you by strengthening, like having you move in those same directions so your body gets more used to it. It won't address the dizziness directly, but as you're getting more used to those motions, you'll be experiencing that dizziness less, and the nerve will have time to recover on its own. Does all this make sense?
Mm-hmm.
Another exercise that we can do that I'll give you for your home exercise program is similar thing, looking at your thumbs, but But this time I'll have your nose looking at one thumb, look with your eyes to the other, and then move your head. And then we'll go back and forth, moving your eyes first and then your head. Again, it'll help with that gaze stabilization. So go ahead and try that for me. Look with your eyes first, then eyes, and then head. Good. Eyes, and then head. Good. Kind of helps train that vestibulo-ocular reflex, or the gaze stabilization. That'll kind of help you throughout your day-to-day stuff, such as going in the grocery store, driving, if someone calls your name and you need to turn, those sort of things will kind of help you get better. I believe that is everything. That concludes the test.